Okay.
Hi, Brynn.
How are you?
I'm good. Thank you so much for joining us.
Yeah, this is awesome. I'm excited.
Thank you for taking the time. So let me introduce Brynn. This is Brynn Cicippio. She's a licensed marriage and family therapist. She specializes in treating people impacted by addiction. So, Brynn, tell us more about what you do.
So as you said, I'm a licensed marriage and family therapist. I also, in Pennsylvania, have a certification as an advanced alcohol and drug counselor. So what that means is I have additional supervision in an additional training, and I had to take additional testing to serve clients that experience addiction. So in my practice, I not only support clients that are looking to get into recovery or sobriety, but I also work with people that have been impacted by addiction. So this could be someone that's in a relationship with someone who is addicted currently or in recovery. Or I also work with people who were raised in homes by parents who were using, either one parent or both parents.
So, and this is for alcohol and drugs or just alcohol
Alcohol and drugs.
and drugs?
So
Perfect.
I don't work with like gambling addiction or sexual addiction.
Okay.
That's a different specialty.
Okay. Perfect. So, from your expertise, what is the correlation between addiction and confidence?
So I think it comes in one of two ways. What I have seen is that first, if we have individuals that are using themselves or have their own history of drug and alcohol abuse, that a lot of decisions they made while they were in active addiction is not usually the decisions that they would make as a sober person. And it then shakes their core belief that they are able to make healthy decisions and
Mhm.
that they are confident in their decision making. A lot of times there's mistrust that surfaces in various relationships. There's a lot of shame, there's a lot of guilt, and people don't really feel, or there's a big struggle, I should say, in the early stages of recovery to feel that they are worthy of recovery, that they deserve a better lifestyle, that they can do this, that they can live a life in sobriety.
So, how do you think people, how do they undermine their own confidence and well being in terms of addiction?
Well, I mean, one of the most obvious ways is with chronic relapsing. So, a lot of times we will see people that will start to accumulate some level of success. And I don't mean material success by that, but we will see people that will start to gain periods of sobriety, begin to change their lifestyle, begin to develop sober supports, get a job, maybe get a job that they feel really proud of, um, have other accomplishments that they can feel proud of. That may also be getting a license back or completing, a sentence of probation or finding a new relationship. And because they do not have the confidence that they can continue with that or that they don't deserve that, they will relapse. I want to be clear too, that's not the only factor in their relapse, but that is what I see a lot, that people don't feel that they deserve the success that they are experiencing. And that is one factor that plays into relapse.
And do you see that there's a certain time that you see people are more relapsing than other times? Is there seasonal or something that you can, a pattern you see from your practice?
So I wish there was a pattern because that would make my work a lot easier. So
Easier?
I can say at this time, um, I mean, traditionally, the holidays are usually a difficult time for people for a whole host of different reasons. I would like to say that in the early stages of recovery, people are at greater risk, but that's not always the case. I've worked with people that have been sober for a number of years and then have experienced relapse. So it's really different from person to person. And I think it also, because it is so different from person to person, and there's not always a time or a pattern, that really speaks to the importance of doing your work and always being connected to sober supports.
So let me just reintroduce you again. This is Rabab Alma. I am interviewing Brynn Cicippio. She is a licensed marriage and family therapist. If you have a question or comment, please include it in the comment section and I will convey it to Brynn. So we hear in the news a lot, Brynn, that it's becoming an epidemic, drug use. So What do you say about that?
I have I have difficult feelings about that because it's been an epidemic and it didn't receive enough attention until it became more than an epidemic. I think that certain drugs gain certain attention. I think that, and I think it's all warranted. So I want to be clear in saying that is it an epidemic? Yes. Does it deserve attention? Yes. Are opiates, when they are misused, a powerful drug? Absolutely. Are there other drugs that I believe can be just as equally as damaging, and as powerful? Yes. Alcohol being one of them. And I also believe that benzodiazepines are another drug, methamphetamines are another drug. I mean, a drug is a drug. So if it's getting to a point where it's ruining your life and ruining your relationships, no one can trust you, you're doing things that you would not normally do when you're of a sober mind, I think that is a huge problem. So, yes, it is an epidemic. Yes, it does deserve attention. I wish that it would have gained attention many, many years ago. And I wonder if we would be in a different place now if it had.
I see. So, what is it that someone can do to prevent the relapse? I know it's like a whole, it can take a long time, but what's the one thing that you think you recommend for people to do or not to do in order to prevent relapse?
Right. So one thing that I recommend to all my clients, and it's like a silly visualization, but I think sometimes the more simple things are, the more manageable they feel. But I recommend that my clients picture their life in recovery to be like a pie. So if we take a pizza pie and we have 8 equal slices in it, and looking at how balanced is your lifestyle, because addiction thrives off of extremes. And so we really want to avoid that, and we really want to strive for a balanced lifestyle. So I don't want you working 75 hours a week, and I don't want you going to the gym 7 days a week for 3.5 hours at a time. And I don't want you quitting your job, staying at home, and binge watching Netflix for 13 hours a day. So we really want to look at what makes up a healthy lifestyle, which I would consider is each piece of the pie. And that's different from person to person. So some people may have time with their kids in their pie, and other people may not have children. So that wouldn't be a part of their pie. But things that connect to what makes a healthy lifestyle for you and having equal time for that, or trying to create the slices to be as equal as possible. So how much time are you spending at work? How much time are you spending with family? What are you doing to attend to your physical needs, your medical needs? Are you scheduling doctor's appointments? Are you getting glasses if you need glasses? Are you reading books and engaging in hobbies? Are you having some sort of physical activity? And where are you having fun? I think there's a lot of work that goes into being in recovery, and it's a complete change in lifestyle. And I also think that sometimes people miss out on the fun, and they think, oh my God, this is so hard. This is such a struggle. What did I get sober for? I had more fun when I was using, or there were more fun times when I was using. So really making sure that you can connect to activities that support fun in sobriety.
So again, for the audience, please share this video. It's very important. Someone needs to hear what Brynn is saying. So again, Brynn, when you say fun, how can we match the level of when people are using, they are reaching a certain level of high, for instance. So
Right.
so I mean, having fun doing whatever activities cannot match that high, if you will. So how
No,
would you
so I
navigate
mean,
that?
right. And so chemically speaking, the amount of endorphins that are released when you are using drugs is greatly different than when you are seeing a movie and laughing. So we have to retrain our brain, and we have to develop new neural pathways to support new experiences and to have your brain to connect to those new positive experiences. So being patient with yourself and understanding that this may not be that rush, but it's also not going to bring you all the devastating effects that happen afterwards.
So how do people, how can they create new neural pathways to help them recover or change their mindset, if you will?
So one of the best ways that I was taught in understanding how a drug impacts your brain and how it develops neural pathways is if you can picture if you picture in your mind that you are coming upon a green grassy meadow,
Mm-hmm.
right? And you can see as people have taken the same path time and time again, the grass gets matted down,
Yes.
right? So you can come across upon this grassy meadow, and even if nobody's around, you can see where people have walked and how they have created a path.
Mm-hmm.
So that would be how the drugs develop these automatic responses in your brain. So the good thing is that if you come across a grassy meadow and you put a sign up and you say, hey, you can't take this path anymore, and people start going down a different path, that matted down grass will grow back. And eventually you won't be able to tell that there was this old path there. So a lot of it has to do with being patient with yourself and continuing to expose your brain to these new positive experiences.
You put it in a very nice way. I really like it.
Well, I can't take the credit for that. Someone taught that to me.
Well, still, I like
But
it.
it makes a lot of sense. And I'm a very visual learner, as you can tell with my
Yes.
pie and the grassy meadow.
Yeah, you want to see it like in front of you. Yeah, yeah.
Yeah, so
Yeah.
visualizations help me.
So you think when people do this visualization, why would they relapse? If this grass grew and they became sober for quite some time, what are the reasons you think, or some of them?
You know what, Rabab? There's so many reasons that lead to people relapsing.
Mm-hmm.
And sometimes it could be, hey, it's a Tuesday in August and I don't understand the rhyme or reason. And other time it can be in response to very difficult emotions,
Mm-hmm.
whether it's celebrations or loss or death, extreme change. Sometimes people also have co-occurring, mental health issues happening. So if I have someone that is in recovery that also has pretty severe depression and is not treating the depression or is undiagnosed with depression or bipolar disorder, sometimes if their mental health isn't, optimum, that can really compromise their recovery. So I would love to say that this is the reason and that's the relapse, and that's one of the things that makes addiction so complex to treat, is that there's not a one size fits all, and there's not, these very simple formulas to treat it.
So do you think working with the underlying reason behind the addiction is a step to a recovery?
Oh, absolutely. So my belief and my framework in working with clients in my practice is that addiction is just an outward expression of something else that's happening for you. Um, Sometimes people will avoid certain situations or avoid certain emotions, and they will work 80 hours a week. And other times people will drink 80 hours a week. So I don't think that there's really much difference there when we're looking at what's really happening and how are you expressing that. Sometimes it's avoidance, and that's why sometimes people use to feel feelings, because they may feel numb or disconnected from their feelings on a regular basis. And sometimes it's to avoid difficult feelings too.
So if there's trauma or bereavement or something like that, they need to work on that.
Yeah. There's definitely I have yet to work with someone where there is not an underlying or more root level cause to what is happening in their life.
Absolutely.
Yeah.
Absolutely. So how do you think someone can work on their confidence and well-being alongside this visualization that you mentioned to keep them on the track and to stay away from?
So when it comes to getting into recovery and living a life of sobriety, having support in your life in all different areas is key. And just like we have that pie, we also need a pie of support. So working with professionals, working with peers, having a mentorship, whether that's through your job or in your community, you really need to surround yourself with support on a regular basis. How I would correlate this to confidence is that if you are in a bad mood and you walk into a room full of 100 people and they are all smiling and happy and overjoyed to see you, it may be challenging for you to stay in a bad mood. And if you are happy yourself and you walk into a room full of 100 negative, angry, stressed people, it may be difficult for you to stay happy. So you have to surround yourself with people that are similar to you or similar to how you are striving to be, people that match your vision. So when we have someone that's, wanting to get into recovery or just starting out in the early stages of recovery, we may have the conversation, what does this look like for you? So you want to get into recovery, but why? And I really encourage clients to not talk about how they don't want to be. So sometimes you may hear clients say, well, I don't want to be stealing from family anymore, or I don't want to tell lies all the time, or I don't want to continue to let my kids down. Okay, that's fine, but that doesn't give us a direction as to where we're going, right? That's where we want to stay away from. But where are we going? So I do want to spend more time with my kids. Well, what does that look like? Well, I want to be a part of their school PTA meetings, or I want to volunteer at their school, or I want to be the one that puts them to bed every night. So now we're developing a clear vision of where you want to go. And if you can connect and build supports in your life of people who match that, I think that really increases your confidence. It lets you know that other people have done it and that you can do it too. And it gives you motivation as well.
So how can people deal when their family system is not that supportive?
Families are really
as a
complex.
marriage and family therapist, we have to really tap on
Yes,
that.
yes. Yeah, so that's really a huge challenge for a lot of people in recovery and in the early stages of recovery, because not everyone is supportive of your change, or not supportive of the way you are going about changing. A lot of families have their own belief system, they have their own rules, they have their own expectations. Some families may say to the person who's using, well, you should just move to California and that would solve all your problems. Or you should just quit your job. Or you should dump that boyfriend. Or you should just go to rehab. And while some of those things may be helpful at times, it's not always this like clear cut solution. So that can be another struggle for clients, is that they are looking to their families who they love and the families love them. So I want to be clear that families are not saying do these things because it's going to make your life worse, or we don't really love you, or don't really care about you. But they are giving these suggestions from a place of love, even though it may not feel supportive or may not match what the client is, has desired in their life. So it can be a big struggle for individuals to say to their family members, hey, I don't really agree with that, and I'm going to do something different. And I think, speaking about confidence, that takes a tremendous amount of confidence that you are making healthy decisions. So we really are like getting into this complex factor here where we have someone that hasn't been making healthy decisions, that really struggles in their belief and how they feel about themselves. And then they are looking to their family who they feel, has their best interest at heart. And now we're asking them to all of a sudden have this magical confidence or this magical ability to say to their families, hey, thanks, but no thanks. I'm going to do things differently. And it's going to work out.
Yes. Given all the history that the family is experiencing with this person. So imagine how challenging this is.
Oh, absolutely. Absolutely. So the family members aren't trusting the addicted person. They're not believing them. They are going to say, every decision you've made in the last 3 years has not been helpful to you. Exactly. Or has not worked out. What makes this any different?
Exactly.
Right.
Yeah. So how, before I ask you this next question, thank you, Anissa, for joining us, for your comments. Again, share this video. This video is very important. Someone needs to listen to what Brynn is saying, and we thank her for joining us. So again, you talked about trust. How can the person who is struggling with this build trust with the family system when they don't have trust among themselves, and right. They are doubting everything they're saying?
Right. So 2 things on that. When we talk about trust, one of the things that I find to be most difficult is that it takes time. So we need family members to understand that, and we need individuals to understand that as well. Excuse me 1 second. Yes. Sorry.
No problem.
So it's not something that happens overnight, which I think is a struggle for a lot of family members. And I think people want it to happen overnight on both sides. I think the family members want it to happen overnight. And I think that the person that's getting into recovery wants it to happen overnight too. There's a lot of effort being put forth, and there can be a struggle to be patient. And the person that's getting into recovery can say, I'm doing all of these things. My mindset is different. And they're the only person that's inside their head. So it can be really hard to prove that. So time is definitely one thing. And the only way to build trust is to become a trustworthy person. So show up and follow through. That's how I kind of say that we can develop to be a trustworthy person. Say what you mean and show up and follow through. And sometimes we're not always going to talk about happy things. So for example, if you were contacted by an old associate that you used to use drugs with, you need to be honest about that. And that may not feel good, and people may get upset about that, but that's part of being a trustworthy person. Because if you don't share that and someone finds out a week, 2 weeks, a month later, now the trust is broken again. Why didn't you share this? Why didn't you let us know? You're hiding something.
Well, I think it's a process of building the trust. It will be broken and rebuilt and broken and rebuilt until it's like consistent. I think
Right.
building that confidence that they will believe me, given all the history that I'm not trustworthy, I was always lying or stealing.
And also
Yeah.
leaving room for error too. So no one is perfect, right?
Okay.
So we have to leave room for human error, where if someone says, oh, I forgot to do this, that they may probably really did forget to do it. And that's okay, that no one is perfect. So
Yeah.
again, really having that balance between showing up and saying what you're doing, but also leaving room for human error, because we all make mistakes.
So how can people with addiction support themselves in terms of community? Like you have the family systems, whether they are cooperative or not, but then in
Mm-hmm.
terms of community and group, do you think they can find some groups to help them, on this recovery path, if you will?
Yeah. So there's a tremendous amount of support. And one of the beautiful things about technology is that you can even find community support in online chat rooms as well.
Yes.
So people can attend all sorts of meetings, AA, NA, so that's Alcoholics Anonymous, Narcotics Anonymous. Sometimes people that are addicted themselves have been raised by addicted parents
Mm-hmm.
or are in relationships with other people who are also addicted or in recovery. So they would be appropriate for Al-Anon or Nar-Anon, which is for friends and family members of addicted individuals. There's Smart Recovery, there's Celebrate Recovery. There's so many, and these are all free, open to the public meetings. Some types of groups will also have closed meetings, which are more confidential. A closed meeting means that it is only for people that are going for themselves, that are experiencing that specific difficulty.
Mm-hmm.
But open meetings, anyone could attend. Like where I teach, I have my students attend open meetings so that they can learn about the process of recovery.
Oh yeah, I forgot to mention that you also teach at LaSalle.
Yeah, yeah,
So
I
tell
teach
us.
in LaSalle's graduate program. I teach a lot of the addiction courses there.
Oh, okay, okay, wonderful. So, in terms of, do you have any success story to share with us on someone like were able to recover and not relapse?
So I have, I'm trying to think of a way to share this while maintaining client confidentiality.
Of course.
But I had a client that I worked with many years ago through actually the drug court program in Montgomery County. And this person had experienced, I think it was something like six overdoses, six hospitalizations. I think some were comas in a period of 6 months.
Wow.
It was really crazy and intense. And this was before I met them. They ended up in jail, and then they ended up working with me. And they, by the time we were finished working together, had accumulated, I want to say, almost 3 years of sobriety.
Wow.
And were living on their own and had healthy relationships and had trusting relationships back with their parents. So
So
that
it
was
can
definitely
happen.
wonderful.
Yeah.
I definitely have a lot of clients that I've worked with who, once they become committed to recovery, are able to do that. I had a girl one time that I was working with who, again, this was years ago, she was a part of the drug court program. In our individual session, came to me and told me that her sister had recently been prescribed pain medication for a medical procedure, which was completely normal. Her sister was not an addict or in recovery.
Mhm.
And she told me that she had stolen the medication
Oh.
and that she had not used it, but that it was in her car. So she went out to her car, got the medication. I did drug tests on her. and she was being truthful and honest. We had counted the pills. She had called her sister in the office with me, told her sister what had happened. And I believe, she has over 5 years of sobriety at this point in time. So
Wonderful.
there's a lot, and they're just a couple I can think off the top of my head, but there's a lot of people that experience success and that once they become committed to recovery, that they are highly successful. And once they are able to examine their life and look at their behaviors and address some of those, deep rooted issues and also build a support system around them, that they are successful in their recovery for a long term, for years.
Wonderful. Is there any a challenging story that you can recall?
Well, yeah, there's a lot of challenging stories. I've worked with clients that, as I was stating earlier, once they begin to experience a level of normalcy and success in their life, they don't have enough strengths and underlying resources and confidence in themselves that they relapse. So it's commonly referred to as self-sabotage.
Mhm.
When working with addicted clients, you'll hear a lot of people say, I self-sabotage, I self-sabotage. And that's something that definitely happens as well.
And is there like a certain time, or like you see them for a certain time and then after that you don't, if they are relapsing over and over, or there is no limitation?
Well, if I have clients that are relapsing over and over, then we're going to discuss the level of care. So in my private practice, I see clients once a week. And if that's not enough support, we will look at if they need to go to a partial hospitalization program, which would be like 6 hours a day, 5 days a week, or if they need to go to an inpatient program in which they stay there. So if I have clients that are chronically relapsing and really having a difficult time maintaining their sobriety, that will be the recommendation that we make, to increase their
The
contacts with
support.
supportive people. Yeah.
Are there any apps like on the phone, apps that people can use to help them to?
Oh yeah, there's so many apps on the phone. So, that was the other thing I was going to say about the community support is that you can go online and Google AA meeting online, and there's chat rooms 24 hours a day that can come up for that. But there's also apps. I know Hazelden has an app, which is a popular publishing company and inpatient program for addicted individuals. But you can have apps that count your days in sobriety. There's motivational apps. There's apps that are related to the 12 steps of AA and NA. But if you just go into, the app store, you can look up recovery apps, sobriety apps, Alcoholics Anonymous apps. There's a ton of information out there available.
Do you think addiction is more prominent among young people or older?
So statistically speaking, it's more prominent among young people.
Mhm.
There is a rise in the elderly population because of the amount of medication that they are being prescribed. One of the most difficult things with statistics in regards to addiction is how the numbers are being captured. Not everyone that experiences addiction is going to a level of formal treatment. So, for example, in my private practice, I accept some insurance, but not many at all. And if I have clients that come in that are private pay, so it's not being reported to insurance, they're only coming and talking to me, those numbers aren't going anywhere.
Yeah.
So it's really skewed as far as how they are capturing the number of addictions. I believe the most recent study for 2017 was that there's over like 20 million people in the United States that are addicted, age 12 and older.
Mhm.
What's concerning about that is that they are diagnosing 12-year-olds with substance use disorders, which means that the onset of use, the first time they use, is way before they're 12. This is looking at by the time they hit 12, are they dependent on a substance or would they make the qualifications for a severe substance use disorder? So again, statistically speaking, the numbers say that it's the younger population, between like 15 and 22. There's certainly a rise in the elderly population, just because of the amount of prescriptions that they're being prescribed. And I think all of those numbers are probably low because there's a large population that they're not being captured. If people go to AA or NA, it's anonymous. Those numbers aren't being reported anywhere. So we have a lot of people that have an addiction or that get into a life of recovery without going to a formal treatment facility like an inpatient program or without utilizing their insurance to pay for their treatment. So there's a huge amount of a population that I think is being missed when we count the numbers.
How about marijuana? which is you see that a lot in schools. Um, do you see it a lot in schools or in like younger people or older population?
So a lot of the people that I work with, that's not what they're coming in for,
Mhm.
but it is certainly part of their history that that is something that they have used at some point in time. But that's not what they're necessarily coming in for.
Do
Their
you think
addiction has progressed onto other drugs or to include other drugs by the time I see them.
so? Do people come to for treatment because of marijuana or they don't?
Um, so I can only speak for myself. Like,
Yes.
I mean, obviously,
Yeah, I'm
I
talking
would
about
say
yeah,
yes.
yeah.
I would say there's probably a greater teen population that may seek treatment for marijuana use, and that's probably, I kind of want to say that maybe at the request of their parents. But like I said, a lot of the people that I see are using opiates or using benzos or using alcohol.
Mhm.
Some are using meth. And so marijuana may be a part of that, but it's not their primary concern, I should say.
I see. So again, I'm interviewing Brynn. She's talking about addiction. She specializes in treating addiction or people impacted by addiction. If you have any questions or comments, please put them in the comment section and share this video. Brynn is giving us a lot of information that is very important for a lot of people. So what is your future plans?
Future plans to save the world, right?
Professional plans, if you will. Yeah, professional plans.
Yeah, to save the world. That's what I want to do. um, so right now, in terms of professional, my practice is growing. I recently hired a therapist over the summer. I have plans to hire 2 more therapists come fall and winter. One thing that we are putting together right now on October 2nd in Perkiomenville, which is right near Collegeville in
Mhm.
Pennsylvania, we are hosting what's called the Partners Recovery Retreat.
Mhm.
So this retreat is specifically for individuals that are in a romantic relationship with someone who is either actively using or in the early stages of recovery. We decided to serve this specific population because these people are often the caretakers and they are not really tuned into caring for themselves. And usually therapy becomes a back burner for them, or they feel hopeless about the possible outcomes of therapy. They may say, well, if my partner is the one who's using and I'm not the problem, why do I have to go to therapy?
Mhm.
So I have, some myth busters available about that, but we really wanted to have one day where we could really provide a lot of information and get to some therapeutic work and really have these partners leave this retreat with a specific plan on what they can do to increase their own mental health and well-being regardless of what is happening around them.
And this is on October 2nd, you said?
Yeah, so it's on October 2nd. It's from 8:30 to 3:30.
Okay.
Breakfast and lunch will be provided. It's at the Old Mill House in Perkiomenville, which is right on the water. So we will have some access to their outside patio, which I think will be really nice at that time of
Absolutely.
year.
Yeah.
We are going to have intense therapeutic groups on trust, on shame, on developing your own recovery plan. We are also going to have some self-care stations where you will have an introduction to yoga in a way that provides you with grounding techniques. So if you're feeling stressed or anxious, that these are easy to use. We will also have chair massages available.
Mhm.
And we will also provide some tips and tricks for organization because self-care isn't always about, bubble baths and reading a book and walking along the beach. That sometimes self-care is about doing things that need to get done and feeling accomplished and feeling a sense of pride about that. So we have a lot packed into one day, but that was
It sounds,
our goal and our intention was to really give as much value as we could in this one-day experience to our clients or to
and
the attendees of the retreat.
how people can sign up for that? Do you have a link or something that people can join?
Yeah. So I have a link that I can send you. We can post along with this video.
Yes.
There's also links on my professional Facebook page, Brynn Cicippio, LMFT and Associates. And if you also go onto my website, which is www.therapywithbrynn.com, if you click on the top bar, it says something like if you're in a relationship with an addict, and it says click here for your free guide. That will get you started
Oh yeah, I've
to
seen
retreat
that
as
on your,
well.
yeah, I've seen
Yeah,
it on your website. It's
yeah.
really exciting. Yeah. So maybe if you don't mind, after this, you can post this link
Oh,
on
definitely.
in the live, so people can join. And it's very exciting program. I read a lot about it. All the
Thank you.
links that you've sent. It's really exciting and very well done.
Thank you.
Thank you, thank you. So at the end, can you tell us how? What are your last thoughts that you can share with the audience?
So my last thoughts in specific to addiction and confidence is that sometimes you need to borrow your confidence from other people in the beginning before your wheels start turning and your motivation begins to build. So the best thing that you can do for yourself if you're looking to get into a life of recovery or to live a sober life is to surround yourself with other people who are doing the same, whether that's professional people or people in your AA meetings, or finding new friends, or maybe connecting with distant family members. If you have a cousin in Iowa who's in recovery, maybe you should call them up, or maybe you should message them on Facebook, because thank God with social media, it's so easy to contact people.
Absolutely.
But really immerse yourself in a supportive community where they can lend you the confidence that you may need so you can make really healthy decisions for yourself.
That's amazing. Thank you. Thank you so much, Brynn, for joining us. Again, if you want to contact Brynn, she will put her information underneath live on Facebook. This is Rabab Alma. If you like this video, like it, share it, and I will download this video on my YouTube. You can also subscribe to it and watch it over again. Thank you again. And if you would like to contact me, you can contact me via my professional page. Thank you, Brynn. I really appreciate all of this.
Thank you, Rabab. This was wonderful. Thank you for having me.
Thank you for having us, for joining us. Thank you. I appreciate it. Have a wonderful day. Thank you.
Thank you. You too.
Thank you. Thank you.